What if we could provide the most effective cancer treatment for the patient on day one?
What if we could limit the impact of stroke?
For years, the Stevens Family Clinical Research Institute has unleashed the power of what if to drive new medical innovation. And now we're taking the next big leap. With 7 Tesla MRI technology, we'll join a handful of institutions around the world providing advanced MRI in the clinical setting. And together, Carle and the University of Illinois will pioneer new solutions, creating a vital bridge between research and clinical treatment, and turning an evolution in technology into a revolution in care.
What's particular about the 7 Tesla is it's the most powerful MRI system that you can buy. So I think if we compare a 7 Tesla MRI with the systems we have now, it's like thinking about the Hubble telescope versus telescopes that are on the land. So things that we knew were there but were very, very fuzzy, we can now see in much, much greater details. So for example, tumors, we see not just as one blob, but we see individual components of those tumors and how they might react differently to therapy.
We have a really unique plan for implementing the 7 Tesla program at Carle. It's first and foremost a partnership between the University of Illinois, the Beckman Institute at the university, and Carle.
We also have a collaboration with Siemens, which is the manufacturer of this device, and they're particularly interested since this is one of the very first that's going to be put into a regional hospital.
And what that means is that we will have discovery science pushing the boundaries of the 7 Tesla right next to clinical application and clinical care.
Typically 7Ts sit in big cities. This is a huge opportunity for us to be able to image a wide variety of participants, including participants that would come from rural settings.
Research at Carle helps us create a culture that encourages physicians and staff to push the boundaries of clinical care.
We don't just want it to disappear into the basement at Carle. We want to try and serve as much of the population as possible.
So we want to be able to develop technology that can identify different chemicals, different structures, different functions of the brain in particular, and be able to then perhaps develop treatments and interventions that can be impactful much earlier in the disease process.
One of the most exciting things, I think, is to try and couple this very sophisticated technology with actual patient care. This is one of the very, very few institutions around the world where we're going to have this kind of MRI scanner, whose primary purpose is to improve patient care.
The 7 Tesla MRI means that our patients will be able to access advanced imaging closer to home. It also means that we will be able to more quickly detect diseases like Alzheimer's and Parkinson's.
The new technology of 7T will allow us to target smaller lesions in the brain in patients who have epilepsy, and we'll be able to cure those diseases earlier and perhaps cure diseases that we were not able to cure before.
I think the 7 Tesla is obviously going to directly benefit our patients through giving us higher image quality for our clinicians. But I think it's also a sign that within Carle and the medical community here, we're moving really into the high-tech sector.
The 7 Tesla MRI program at Carle is a truly exciting alignment of fundamental discovery, clinical research, and rapid translation into real-world applications for this technology.
With 7 Tesla, we'll join an elite group of researchers looking for big breakthroughs in the smallest structures of the human anatomy. Working closely with the Beckman Institute and other leading partners, we will transform the way healthcare is delivered both here and around the world, pioneering bold innovations, pushing the boundaries of medicine, and turning what if
What if?
What if?
into what comes next.